Good morning, Sarah. Beautiful day, isn't it?
Yeah, but a busy one. Hey, did you get this memo? They're doing another HIPAA in-service.
Yeah, I don't get it. We respect our patients' rights, we maintain confidentiality of records, we even get the consent form signed, and still there's more meetings. What's so important about HIPAA?
That's a good question. One I asked myself when I became our agency's privacy officer. Why are we spending so much time on the HIPAA privacy standards when there are other things to do? But then I took a look at our agency's privacy practices, and it was quite an eye-opening experience. Watch these few scenarios, and you'll see what I mean.
Medical records, this is John. Yes, we're admitting Robert Johnson today. His diagnosis is liver cancer. I'm sorry, who did you say you were? She hung up on me.
Oh, finally, the orders for my new patient. Can I help you?
Yes, I'm from Accountants Plus. I have an appointment with Eileen.
Just a minute, I'll get her for you.
Thank you.
Julie, Dr. Owen on line 1 about Jackie Stewart's infection.
Kathy, how are you?
Did anything look familiar? Because HIPAA privacy standards go beyond the office. Let's look in on one of our nurses at home.
Get off the computer. You know Mom doesn't want you playing on it. She'll be home any minute to finish her paperwork. She doesn't care. Hello? Mom's not home right now. May I please take a message? The HIV test for Jack Pierce came in positive today? Okay, I'll tell her. Bye. I think that was Mr. Pierce, a teacher from my school. Hi.
Hi, is your mom home?
Yeah, well, we're home, but Mom's on her way home from a meeting.
Okay.
So.
Well, I'll sit and wait for her if that's okay. So how are you girls?
We're doing good.
School good?
Yeah.
Hi, girls.
Hi, Mom.
Well, hi, Judy. Well, hi, Amy. How are you? I'm good.
Mom, can we go to the park?
Is your homework done?
Yeah.
Sure, that's fine. Yes. Be careful.
Yes, we know.
Oh, what a day. Busy, huh? It was so busy. I see here that you're taking care of the alderman.
We are, and let me tell you, he's not doing well.
Yes, it looks like he has some problems here.
Did you watch all the privacy breakdowns in those couple of minutes? Talk about culture shock. Before we get into more detail about what we needed to change in our agency, let's back up and take a closer look at HIPAA so you can see why we needed to change some things. HIPAA, that stands for the Health Insurance Portability and Accountability Act. It's like no piece of legislation you've ever seen. It started out as a law that governs the portability of health benefits between jobs and standardizes medical coding and billing practices. Along with that came the need to establish a set of basic national standards and fair information practices to protect the privacy of medical information and records. Privacy is one of the basic HIPAA principles. It's a fundamental right of an individual to control personal health information and not have it divulged or used by others against the person's wishes. It used to be that a breach of confidentiality meant a piece of paper ended up in the wrong hands or a conversation was overheard by the wrong person. However, the growing use of electronic storage and transmission of records creates the possibility for more breaches of confidentiality. So HIPAA set out to tackle these problems and protect the privacy of individually identifiable health information. To accomplish this, the HIPAA regulations had to overcome one big challenge. How do you balance the need for medical records privacy against the release of information to those who have a reason to know? In other words, the patient has the right to privacy of his or her health information and the right to control that information. However, healthcare providers need access to that information to provide care. Healthcare organizations like your home care agency must provide maximum protection for patient privacy without compromising either the availability or the quality of medical care. HIPAA tries to balance these two objectives by giving providers flexibility in complying with a set of minimum standards for privacy. These standards will protect and enhance consumer rights by giving us access to our health information and, at the same time, protecting against inappropriate use and disclosure of the information. And there's an added benefit, strengthening the trust relationship between the clinician and patient. The patient will be able to give full and accurate health information, trusting that the clinician, while using the information to provide health care, will keep it private. These minimum standards have far-reaching implications. You'll find that HIPAA goes beyond the confidentiality of medical records to every piece of health information. Beyond what you write in the clinical record, to the words you send via fax or email, the voicemail messages you leave for a coworker, and conversations in the lunchroom. Your ultimate goal is to maintain confidentiality and security of patient health information. What kind of information are we talking about? Unless otherwise required by law, all communication about healthcare matters between the patient and the practitioner or caregiver is protected. By extension, healthcare communication about the patient between members of the caregiving team is protected. Records pertaining to these conversations or events involving the patient are also protected. Confidentiality is a key concept in understanding HIPAA. It is a professional obligation, a means of protecting health information, safeguarding it from unauthorized disclosure. As a provider of healthcare services to patients in their homes, you have an obligation to maintain confidentiality of the patient's protected health information. For HIPAA purposes, that's any electronic, paper, or oral data that can be used to identify an individual patient's health or medical condition or treatment, including information such as name, address, social security number, Medicare number, date of birth, telephone number, occupation, employer, and more. You probably heard that HIPAA requires sweeping cultural changes within an organization to accomplish these objectives. But exactly what does that mean? Let's glean a few insights from the field of anthropology to better understand this. A culture is a way of life, values, ideals, and behavior that are shared with others in a particular group or society, producing similar behavior and thought. Every culture has its patterns, combinations of qualities, behaviors, and tendencies that affect how people will respond in different situations. When it comes to HIPAA, we need a privacy culture, a way of life among all the staff in a home care agency that protects the patient's health information. In the HIPAA privacy culture, protecting patients' privacy and maintaining confidentiality become a natural part of everyone's job. The first step moving towards a HIPAA compliance is to understand what your privacy culture is today, so you can determine what you need it to become. Let's take a closer look at those scenes from my agency to identify the behavior patterns regarding privacy and protected health information we needed to change. The first one, careless verbal communication. The second pattern, absent-minded communication. Pattern 3, lax computer procedures. Number 4, inattentive handling of written information. And the last pattern, unguarded techniques for information transmission. You can see the challenges we faced. Our staff were not attuned to respecting the privacy of patients and maintaining confidentiality. We had a lot of work to do and things to learn to become aware of and sensitive to privacy issues. So how did we turn things around? How did we get our act together in order to comply with HIPAA? The actions we took to build a privacy culture can help your agency meet the challenges of HIPAA. It's important to start with a meaningful, clear corporate vision for HIPAA compliance, a healthcare delivery environment that is conscientious, diligent, and thorough in protecting privacy rights and confidentiality of information. The agency's leadership must develop a plan for the agency to protect the patient's privacy, including a comprehensive review and revision of policies, procedures, and security measures, and important actions like identifying every source of PHI and the individuals with access to it. Then it's time to work with the staff. The first line of defense against unauthorized use and disclosure of PHI is the nurse, therapist, social worker, or home health aide who interacts with the patient, the one who gathers the patient's health information and passes it along to others in the home care delivery chain. The attitudes and behaviors of these first-line employees are key to achieving the objectives. HIPAA education begins with the fundamental concepts of privacy, confidentiality, and protected health information, all blended together into TPO, treatment, payment, and healthcare operations. An understanding of TPO forms the heart of HIPAA compliance. HIPAA regulations permit the use and disclosure of protected health information for the purpose of TPO without the patient's prior written consent or authorization. Healthcare providers need to share certain types of information without restrictions or time delays in order to meet the patient's needs. Being able to share necessary information whenever necessary gives healthcare providers the flexibility to make important decisions and ensure the patient receives appropriate care. Just because we don't need the patient's written consent doesn't mean we can drop our guard. We must be vigilant about protected health information. Let's take a closer look at TPO, beginning with treatment. Treatment refers to health information shared for treatment purposes between the home care agency and other healthcare providers who have a direct treatment relationship with the patient. This starts at time of referral and carries on throughout care, into and even after discharge. For example, the intake coordinator of the agency receives referral information about a new patient from a hospital discharge planner. A physical therapist updates an outpatient therapy provider about a patient. A social worker coordinates a referral to a community service agency, and a registered nurse talks to the emergency room nurse about a patient who is transferring. Your home care agency may share a PHI with other healthcare providers for payment purposes to make or receive payment. The key to this information sharing is that there's already a relationship between the patient and the payment organization. Staff can disclose information for payment purposes to a benefits coordinator to find out about a patient's coverage, a case manager who oversees the patient's care within a health maintenance organization, an individual who pre-authorizes services for a community options program, or a Medicare claims representative where there are questions about a claim. Finally, when two or more entities have a relationship with the same patient, they can disclose information for limited operational purposes. A home care agency might share a PHI with the compliance committee when tackling a problem, surveyors involved with accreditation, certification, or licensing, members of its ethics committee to address an ethical issue, or its performance improvement committee for quality assessment and performance improvement activities. So how does TPO fit into your job? The information sharing that goes on in and around the process of care delivery is probably the most involved and important. Let's look at what happens in your office, your car, the patient's home, and with your coworkers. How can you be sure you're disclosing just the right amount and type of information in the correct way? Two important principles guide your actions. The first one, need to know, determines which individuals have access to what information. The second one, minimum necessary, determines how much information they should reasonably get to accomplish the intended purpose. Both a home health aide and a supply clerk need to know certain pieces of PHI in order to perform their jobs. How much information is reasonable for each to know will differ, and depending on the unique circumstances, it's possible the minimum necessary may change. In any case, always limit the information shared to the minimum amount necessary for the purpose. Let's put all of these principles together to construct a HIPAA privacy culture where compliant attitudes, behaviors, and sensitivity to patients' privacy and confidentiality become second nature for everyone in the workforce. To change the patterns of our agency's privacy culture, we had to change the traits, those single thoughts or behaviors that combine to make up a pattern. To develop a HIPAA privacy culture, it's necessary to put into place traits that are HIPAA compliant. The essential traits fall into three categories. We'll call them the 3 C's of the privacy culture: consent, computers, and communication. Consent means obtaining permission or agreement with some action. Consent in terms of HIPAA addresses the patient's agreement with the release or disclosure of protected health information for treatment, payment, and operations, the information necessary for clinical staff and others in the agency to do their jobs in caring for the patient. Consent in this context does not relate to consent for treatment. That's an issue separate from HIPAA. You must continue to follow your agency's policy for obtaining the patient's informed consent for treatment. The focus of this program is on consent for release of protected health information. The HIPAA privacy rule requires healthcare providers to develop a notice about the patient's privacy rights and how to exercise them, the organization's privacy practices, and its use and disclosure of PHI without written authorization. Take some time to review the privacy notice that your agency has developed. The HIPAA rule also requires healthcare providers to give the patient a copy of the notice. During the admission process, before providing any care, the admitting clinician must present the agency's notice and discuss it with the patient. This fits right in with the discussion your agency already has with patients about their rights under the conditions of participation and the OASIS privacy notices. HIPAA requires an agency to obtain the patient's written acknowledgement about receipt of the notice or to document a good faith effort to do so. Chances are that your agency already asks patients to sign a form acknowledging receipt of various notices. Just add the privacy notice to that list. This discussion goes beyond just notifying the patient about the agency's privacy practices. One good trait for building a HIPAA privacy culture is to gain some insight into the patient's situation, so you can take measures to ensure appropriate use and disclosure of health information. For example, during the admission process, try to identify individuals whom the patient considers as part of his or her own inner circle for care delivery purposes.
Who can we call in case of an emergency or consult with if we have questions about your care?
Well, all my children are out of state now, so it would really have to be my good neighbor next door, Mildred. Her address and phone number are in the black book in the drawer.
Assess the level of activity and traffic in the home in order to find a safe place to leave the home folder or other information that's necessary to coordinate care with your team members.
Now that we have this home health aid folder ready for you, I have a question for you. How many people do come through to visit you on a regular basis?
Oh, I don't have many visitors that come to see me. The only one would be my next door neighbor, Mildred. She sometimes brings her grandchildren with her. They're very well-behaved children, and that's their books and crayons on the table.
Then I think the safest place to keep this home health aid folder might be in this drawer.
I think you're right.
Okay.
Be creative. Think about other ways that PHI could be disclosed inadvertently.
Oh, I should ask you, do you have an answering machine?
Oh yes, it's right there on the table.
Does anyone beside you take your messages?
No, no one, just myself.
Okay, that's good.
If only the patient checks the answering machine, it would be safe to leave messages about care and services. However, if others listen to messages, make a note to leave a message asking the patient to return your call. Situations about PHI may develop that were not addressed during the admission discussions.
Hello, how may I help you? Sure, just a moment, please. Barbara, it's your granddaughter. She's calling from university and wants to know how you're doing.
Tell her I'm doing just fine with my new hip.
Okay.
The patient gave her consent for the nurse to release PHI to a person not directly connected with the delivery of care. And then there are emergency situations when the patient may not be able to give consent for release or disclosure of PHI. What if our patient was transferred to the hospital and her good neighbor Mildred was not home? The nurse could use professional judgment and inform the landlord about the patient's transfer. Remember, need to know and minimum necessary govern disclosure of information. The landlord needs to know that the patient is gone and to keep an eye on the house. It would also be reasonable for the landlord to have contact information for the home care agency. However, he does not need to know details about the patient's medical condition. What about the release of information that does not fall under TPO, like giving a copy of the patient's chart to a distant relative who has concerns about the agency's services? This is not information shared for the purpose of treatment, payment, or operations. It falls under a different requirement, authorization. The patient must grant permission in writing in advance for each type of non-routine use or disclosure of protected health information. The release of information for non-TPO purposes is not something clinical staff will routinely encounter. It falls under the auspices of the agency's Medical Records Department, whose staff must know about authorization, in what circumstances is necessary, how to obtain it, and more. Talk with your supervisor if you encounter any concerns. The second C of the HIPAA privacy culture stands for computers, workstations, laptop computers, and handheld devices. Computers carry out important processes and contain critically important patient information. What will we do without them? But to maintain a HIPAA privacy culture, we've got to know what to do with them. The ease with which we can collect, store, and access personal health information on a computer-based system generally means more information is stored, and computerization of information increases the risk of unauthorized disclosure, thereby necessitating special protections to keep information confidential. This is where security comes into play. It applies to the spectrum of physical, technical, and administrative safeguards that a healthcare organization puts into place for servers, personal computers, electronic patient records, billing systems, and modems to protect the integrity, availability, and confidentiality of information. Your responsibility is to know and follow the security measures established by your agency. One of the most important is the personal identification and user verification, more commonly known as the password. The secret code permits the user to access only predetermined parts of the system and protects against access by other individuals who have no right to that information. Guard your password. Don't post it on your computer or pass it on to others, no matter what the reason. Change the password at regular intervals, and don't use something simple like 1234 or your first name. Then think about your computer behaviors, important traits of a privacy culture, which will help safeguard information. A screen with protected health information should not be visible to the public or those who have no reason to know. When leaving your computer, don't leave patient information in view. If you'll be away from the computer for an extended period of time, log out. For laptops or handheld devices out in the field, be vigilant and protect the equipment from damage and theft. Don't open up other patients' files while in a patient's home. Don't let children or others play with or use the computer or device containing PHI. Now, let's look at the last C of our HIPAA privacy culture, communication. This is most likely the biggest risk area for home care staff. You've heard the expression, loose lips sink ships. In home care, we have to be concerned about more than loose lips. There are many forms of communication at risk. Let's start with fax machines. To protect health information, the fax machine should be in a private place, out of sight from any visitors. When faxing information, use a cover page that spells out the agency's terms of confidentiality and disclosure of information. Double-check the accuracy of the fax telephone number and enter it carefully. You'd be amazed at how easy it is to transpose digits and send the request for orders to a pizza parlor instead of the physician. Follow your agency's policy for handling the information that was faxed. Don't leave it lying around the fax machine. Don't forget to obtain verification that the fax was received by the intended party. Then there's electronic communication. Know about the security measures your agency has put into place and follow established policies for emailing PHI. Verify the accuracy of all email addresses. We can't overlook written communication. If your agency is automated, you'll handle less paper than an agency that depends on a paper system for documentation. But there will still be paper to handle, and you must know how to maintain confidentiality. Here's an important privacy culture trait. Think about who will see what you've written so you can take the necessary measures to protect it. In the office, watch the posting of patient-sensitive information on message or bulletin boards. It should not be in public areas. To protect against unintentional viewing or snooping, put clinical records away when not in use. Lock file drawers at the end of the day or during the day if the files are not attended and might be accessible to unauthorized individuals. Shred patient-sensitive information, even phone messages. Don't just toss the paper away or recycle it as scrap paper. There should be a secure system for staff to deposit notes and documentation after hours. An open box is too prone to invasion. Then think about the information that goes along on visits. The agency's policy should be for staff to carry the minimum necessary with them. There's no need to carry months of past visit notes along with you each time you visit a patient. When transporting information necessary to provide services to patients in their homes, protect the files. Maintain each patient's information in a separate file in some organized carrier. It's not a good idea for files to be strewn about in a car. Carry only the patient's file into the home with you. Secure any information you leave in your car when going into a home. It's sometimes necessary for an agency to keep information in the patient's home in order to coordinate services. This would include an assignment for the home health aide, a log for blood pressures or blood sugars, or a wound care flow sheet. File necessary information in a folder labeled confidential and put it in a safe place in the home. Finally, it's time to address those loose lips, verbal communication. This may be where many agencies face their biggest exposure for inappropriate disclosure of information. Before you open your mouth to speak about a patient, think about who will hear it. If it's more than just the intended listener, think twice about what you'll say. When communicating with other staff members, follow the need to know and minimum necessary principles. Provide just the right amount and type of information for them to perform their duties. During a case conference, share just the information the participants need to evaluate and revise the patient's care plan. Once outside the conference, other staff members don't need to know about the patient. In a patient's home, don't talk about another patient, even if it's with a nurse or home health aide who cares for that patient. Don't talk about the patient with others, like a neighbor or relatives, unless you know it's okay with the patient. If an attorney or the media contacts you, say something like, "I cannot discuss with you anyone who may or may not be a patient of my agency. Perhaps you should contact a supervisor at my agency." The telephone is a very important tool for home care providers. Dial the number carefully, know whom you want to speak to, and verify that you've reached the right party. Share only the information that is necessary. What happens when you reach an answering machine or voicemail? If you're unsure about who will receive the message, don't leave patient-specific information. It's better to provide a number for callback. When receiving a phone call, find out who is calling, the relationship to the patient, and what information is necessary. If you have any concerns about the call or caller, contact a supervisor before disclosing any information. Your ability to maintain confidentiality of patient information will be tested in public. It will be more difficult to know who will hear what you say. That's where cell phones can present a big threat. How many times in a grocery store checkout line have you heard all about someone's bad day at work or the problems with a spouse? And then there's an annoying tendency to speak louder than normal. When using a cell phone to talk about a patient, select a secluded spot. Speak normally, providing only the information necessary. Your concerns about public conversations extend not only to working hours, but your time off duty. What if you run into a physician at a school board meeting? What if a friend starts talking to you about a relative who needs home care? Remain vigilant about protected health information. Okay, that's a quick rundown on the 3 C's of a privacy culture, the last of the important information we'll cover in this program. But just because we're finished doesn't mean you are. Your agency will provide education about its policies and procedures regarding privacy and protected health information. And then your job, demonstrating compliance with the HIPAA privacy rules, begins. You might be feeling a bit overwhelmed, maybe even intimidated, but remember, a HIPAA privacy culture is something you must learn. It begins with knowledge of the fundamental principles, confidentiality, PHI, TPO, and more. Add in the important traits for handling consent, computers, and communication. Most important of all, recognize every piece or bit of protected health information that you create or pass on to others. Think about what you'll do with it, who will hear or see it, and take every reasonable precaution to protect it. Before long, your agency will have a strong HIPAA privacy culture, a way of life that demonstrates compliance with the rules, protects your patient's health information, and supports the delivery of quality care.